Hi, good afternoon. Thank you for having me here. So my name is Chian Leong, and I'm here to share with you about some of the insights in terms of what is the importance of biomedical research, especially for the medical students. Now, I think biomedical research, okay, is broad range. So basically, whatever that we call nowadays, we practice the evidence-based medicine. And where is the evidence coming from? And most of the evidence are actually coming from the biomedical research. In general, basically, biomedical research, okay, cover study, okay, that involve specific diseases or condition, including, for example, detection, cause, prophylaxis, treatment, and even rehabilitation of persons as well. So it might involve design of methods or drug or device, okay, that used for diagnosis and support for treatment. It might also involve, okay, scientific investigation that is required to understand the underlying mechanism of certain diseases, including genetic, immunology, and so forth. Basically, there's a full list of such activities, okay, that involve biomedical research, okay, even clinical trials and laboratory investigations, okay, is considered part of the biomedical research as well. Now, so why is research important? I think for modern medicine, basically, research is very important because it allows us, okay, to develop new methods to diagnose diseases as well as to understand the health problems, okay. So whatever treatment that we develop, okay, it will also help to prevent and also to develop treatment, okay, for patients. So it will more research, okay, can be done basically for us to understand, okay, in terms of the biology of the disease, the diagnosis, the prognosis, as well as the treatment and also management of different diseases. So you may ask basically, okay, for medical students, okay, why do you need to have experience in research? So after all, I think for the medical program, all of you guys are probably very busy, okay, with all sort of different activities, clinical practice, and so forth. Now, basically, okay, if you look at the trend, there's a lot more okay, there are more and more medical program or university are actually requiring the medical students to undergo some form of research or having some research experience. And why is that important? Basically, okay, in terms of the research experience for medical students, I think the first thing that you can think of is that having the research experience actually have advantage for you to secure positions, okay, especially in prestigious training program. So, for example, okay, residency in a reputable hospital or residency program, okay, in other university as well. So basically, having some kind of research experience, and even better if you have published anything before you graduate, that will give you an additional advantage over another candidate which have the similar academic excellence, basically. Now, in terms of medical education, so there has been a debate about whether medical students need to do research or not, basically. Now, but the literature, I mean, again and again, there is evidence to suggest that basically, if a medical students involved in research, okay, in well early on in their medical profession, it will actually develop a lasting habits, okay, for them to have critical thinking, critical appraisal, and even more open and more engaging in terms of accepting or rejecting new ideas as well. So at the personal level, of course, okay, research can be quite satisfaction. I mean, can be quite satisfactory in a way because it also answer the curious mindset of certain individual. For example, okay, if you are interested in certain diseases, okay, that you want to specialize in, you might have a certain curiosity in terms of the biological mechanism or pathogenesis, how those diseases actually arise. And conducting the research can, and also the new findings can actually give you some personal satisfaction in terms of, okay, answering your curiosity mindset. Now, research are all about, okay, critical inquiry, basically. So a lot of people also think that, well, research actually needs certain skills, but honestly speaking, most of the time, all you need is basically just the skills of critical inquiry, or in common sense, what we call logic, basically. And this critical inquiry sometimes might require certain skill set, but most of the time really is all about, okay, the logical thinking. So what research can train you up is basically to train you to ask right and good questions, so that you can actually probe it further. So in a way, is that this is a kind of a soft skills, okay, if you might think of it, is that could actually future proof you for different type of careers, whether it is in medical or whether it is in finance or in other career as well. At the end of the day, so it is all about right asking the right question and also solving the right problem of the world. And finally, okay, involved in research can also improve clinical practice. So this is actually somewhat paradoxical, because a lot of people think that, okay, research, if you are a healthcare profession and if you involve in research, will it take away your time with the patients and hence reduce the patient's time and hence, okay, reduce the quality of the care? But but again, while research have actually shown that it is actually the reverse, whereby in hospital or even in for clinicians that are involved in clinical study or involved in research or research active, they actually they actually prove to show that they provide a better healthcare compared to the clinician who are not involved in research. So this is part of it could be because that, well, the clinician that are involved in research, they probably get more advanced information in terms of the treatment, and at the same time, they are also more open in terms of new idea, and hence can translate some of this into the improvement of the clinical practice. So there are many types of research that is involved, that's being carried out, okay, in the medical setting. So in general, basically all the medical research can be divided into either what we call a primary research or a secondary research. Now, under primary research, we have, okay, for example, okay, the basic science or the basic research, okay. Some of this basic research could be very much based on theoretical, for example, understanding the molecular mechanism of diseases, okay, the biology of diseases, okay, imaging procedure, okay, and so forth. Now, there are also another arm of the basic research which is a little bit more applied. For example, okay, genetic sequencing, okay, biochemistry, okay, genetic study as well, to understand what is the effect of certain gene mutations that will manifest in certain diseases and so forth. That is considered as basic research, basically. So it might or might not involve human. Most of the time, we are using a lot of a cell model or animal model, okay, or sometimes a human tissues, okay, to understand the fundamental basic of how the mechanism of diseases and so forth. Now, another type of primary research which you're probably more familiar with is what we call the clinical research. Now, there are two types of clinical research. While it is either experimental, whereby you are actually, okay, introducing certain type of intervention, including, for example, clinical trial, okay, phase 1, 2, 3, and phase 4 clinical trials, for example. It could also involve, for example, using certain type of new medical devices, okay, to for the treatment of certain diseases. So that is what we call the experimental or the intervention study. Now, another arm of the clinical research, it could be observational. In the observational clinical research, basically you do not intervene too much with the patients. All you do is basically that, well, you try to observe, okay, using the current gold standard practice and see, well, if there's any problem or how you can actually improve it, and so forth. So there are a whole series of different type of observational study, okay, including your case series or case report, that is also considered part of the clinical research as well. Now, there are also, okay, epidemiological research, so which is also considered primary research as well in the medical field. So similar to the clinical research, okay, epidemiological research can also be categorized either as experimental or observational. Experimental epidemiological research most of the time involve intervention. For example, okay, you might recruit certain group, okay, one group of the population, you will be giving a different treatment, for example, or different management of the disease, and to look at the disease outcome or the effect of those treatment. Okay, whereas okay, in the observational study, this could be either a cohort study, case control study, cross-sectional study, and so forth. Basically, again, while in the observational study, intervention is limited. Basically, you go into the community, or you go into the what you call it, certain area to collect data. For example, okay, this include, for example, prevalence or incidence of certain diseases and so forth. And all this, okay, basic research, clinical research, and epidemiological research, most of the time is categorized as primary research. Now, the reason why it is categorized as primary research is that because all this research, basically, this type of research, basically involve collection of new data, and this data would then serve as a primary data that can be used for other purposes. Now, and most of it, okay, and in secondary research, basically, so in contrast to the primary research, the secondary research basically do not generate original data. What it does is basically they use the data that is collected from the primary research to make further inference or further induction. For example, okay, your meta-analysis, your literature review, your systematic reviews. So all these are considered secondary research because it is using the data or the information that is generated by the primary research. Now, so when you think about research, basically, you have to understand is that the significance of your research is not in the merit of the problem it tackles, but in the merit of its solution. What this means is basically is that, well, how important or how significant of your research is basically value depends on what kind of solution that you will offer to the problem. So for example, okay, in COVID-19, yes, there are a lot of research that have been done in COVID-19. No doubt about it, COVID-19 is a big problem, it is a crisis, but however, not all the research involving COVID-19 are as equally important. Those that are important are probably the one that will offer a good solution. For example, as of now, basically, if anyone who is working in the vaccine for COVID-19, which is a solution for the crisis, so that will give you the merit and the value of the solution. So that's why, okay, when you embark into certain research, so make sure that, well, okay, instead of looking at the significance of the problem, you should pay your attention to, okay, how significant or what is the merit of the solution that you are trying to resolve. Now, traditionally, okay, most of the research follow the what we call the scientific method, or sometimes, okay, we also call this a hypothesis-driven research. Now, under this framework, basically, you're probably very familiar. Basically, it starts with, okay, identifying the problem, okay, gather the data or conducting the research, then you come up with a kind of hypothesis, then you test your hypothesis. If the hypothesis, okay, is correct, then okay, you go back. If the hypothesis is correct, then you prove uh, uh, um, a certain theory, basically. But if the hypothesis do not agree with, okay, if the data do not agree with the hypothesis, then you go back to reframe your hypothesis. So this is a pretty old, okay, method, scientific method. In fact, it was introduced, okay, almost in the 1800, okay, but surprisingly, it is still being practiced today. So now, but we will see later on is that, okay, whether this paradigm is still relevant or not, okay, given the fact that we now have a lot of new technology that is coming up. So we will come to that later on. But basically, okay, a lot of the research that we have seen to date are basically based on these so-called scientific methods or hypothesis-driven research. So now, Then you might wonder what is a hypothesis basically. So a hypothesis in general is basically a well-stated researchable hypothesis. It normally have five characteristics. First of all, in the hypothesis, you must be able to identify what is the variables or the relationship that you try to measure. So it need to be testable. Okay, that means that you must have a method to test it. If you don't have a method to test it, so then you won't be able to test your hypothesis, correctly. So the hypothesis also most of the time is a statement that is very concise. Okay, normally we will try to write the hypothesis as simple as possible, to answer a critical yes or no answer. Okay, it have to be derived from the problem statement and supported by the literature. In other words, is that most of the time your hypothesis must be based on certain pre-existing evidence, or rationale. So, or else it will be just a mere speculation. And finally, your hypothesis most of the time, must also be consistent with your research questions. So for example, if you have a hypothesis you wanted to test, you think that cancer is caused by mutation, for example, then you must be able to justify, why do you think so? And basically, what mutation are you trying to identify and so forth. So these are the five primary characteristics of a good hypothesis. Now, so to generate a hypothesis, most of the time, it is quite straightforward. So there are three ways that you actually phrase a hypothesis. For the simplest one, for example, is that it's basically using the narrative of if then. So this is very similar to your computer language. So if A happened, then what will happen to B, for example. In this case here, the example, you can phrase a hypothesis in a way is that if a first year student start attending more lectures, then their exam scores will improve. So this is your hypothesis. Basically, when they attend more lectures, exam scores improve. So this is one way to generate a hypothesis, but just simply using the if-then statement. You can also generate a hypothesis based on correlation, basically, where you can actually state the predicted relationship between the variables. For example, the number of lectures attended by first year students has a positive effect on their exam scores. In this case here, it points to a positive correlation between lectures and also exam scores. So another way to generate hypothesis, you can state what is the difference, that you will expect between them. For example, it could be better exam score than those, better exam score or worse exam score and so forth. In general, these are the three ways of the three simple ways that you can actually phrase a hypothesis. Of course, there are more complex ones, but these three most of the time, address most of the hypothesis questions. So I often ask basically is that when we state a hypothesis, should we always state the null hypothesis and also the alternative hypothesis? It depends. Basically, if you are in the research proposal, research grant applications, basically, you normally do not put a hypothesis in this way. So you only list a null hypothesis or the alternative hypothesis for academic purposes, for example, in your thesis or for example in your lecture. In most rare case scenario, basically when you are writing a research grant, for example, all it is needed is basically a hypothesis statement, meaning that most of the time you are just stating the alternative hypothesis. It can be in the form like, for example, we hypothesize that the number of lectures attended by first year students has a positive effect on their final exam scores. That is more than sufficient when you come to write the grant, because there's really no point, to writing two statements basically that are basically mutually exclusive. We just need to write one basically. But for academic purposes, normally we will teach students to write both so that they are clear what is the null hypothesis and what is the alternative hypothesis. Now, I also often being asked basically, is hypothesis always necessary in research? Now, the answer is no, basically. Not all the research are hypothesis driven, basically. If if all research are hypothesis driven, basically you won't have the theory of well, the origin of species or the theory of evolution. Okay, basically, for example, okay, Charles Darwin himself admitted that when he first embarked onto the voyage, okay, he didn't expect to generate the theory of evolution. It is actually through observation that eventually he collected all the data and then synthesized the theory of evolution. So that's why, okay, so not all the research actually have hypotheses, particularly for research that are what we call exploratory research, okay, qualitative research, model development, okay, engineering, okay, high throughput genomics. Some of these might not have hypotheses. For example, okay, Human Genome Project. What is a hypothesis of Human Genome Project? So basically, the whole project is about sequencing the first human genome. That's pretty much it. There's no hypothesis. So that's why, okay, depends on your research, okay, whether it is exploratory research or hypothesis-driven research, okay. Yes, if it is for hypothesis-driven research, then you should have a hypothesis. But for exploratory research, most of the time you might not have a hypothesis. Now, there are different phases of research. So as I mentioned it before, is that, okay, we talk a lot about hypothesis-driven research. This is the one that we are more familiar with. For example, at the end of the research, you will actually answer a specific yes or no answer. But again, okay, so if you look at practically. So hypothesis-driven research, okay, we also mentioned that it must come from certain evidence. Now, where do this evidence coming from? The evidence could be coming from the previous research that other people have published, or most often these days, okay, the evidence actually come from exploratory research. Okay, now what is exploratory research? Exploratory research is basically a study that aims to investigate an issue or problem where there are actually few or no earlier study that have been done. For example, a pilot study, okay, or even a different type of high throughput, okay, genomics or omics study, whereby, okay, we actually have no idea what is going on, but then we want to explore and try to make sense of what is actually happening. So once we have collected the data and we have certain idea what is actually happening, okay, in this, for example, okay, in Charles Darwin's case, okay, he went for the voyage, he just collecting a lot and a lot of samples and a lot of data, basically, that you can consider that as an exploratory research at that phase. Only after that, okay, then you sit down and then you look through all the data, then you discover certain pattern or you discover certain observation which is worth investigating, then only you develop and establish, okay, a hypothesis and to launch a hypothesis driven research. Now, if you can see that, okay, this process can go back and forth many times, okay, whatever data that you collected and then you generated the hypothesis, when you test it, it could be wrong. So, and in fact, um, in most of the scientific career, okay, in my scientific career, basically research career, I can tell you is that at least more than 80% of my hypothesis is actually wrong. So it is not uncommon, basically. So now sometimes, okay, when the hypothesis is wrong, then you have no choice, then you will have to go back to the exploratory research and then explore further and then come up with a better hypothesis. Okay, so this thing can take this cycle, exploratory research and hypothesis driven research, can take can can go back and forth many round, okay, before you found something and then proven something that is useful. Once this is proven useful, then you will then launch into something what we call a translational research, whereby you can actually translate these findings or the scientific findings, okay, into practice. Okay, it could be a clinical practice, it could be a new drug, or it could be a new device and so forth that could benefit the patients and the population. Now, of course, okay, the scientific method is very old, so we are now facing a new type of research now, basically, whereby for the first time in the human history, we are able to generate more data than what we can interpret. In other words, it's basically is that, well, the major shift in the 21st century is that, well, we can actually now generate high throughput data and conduct high throughput experiment in the ways that would not be possible in the past 10 or 15 years, for example. So For example, okay, you can basically sequence the whole human genome now within 24 or 48 hours, okay, to actually look at every single possible mutation in the human genome. So that started a new trend, okay, what we call a data-driven research. So data-driven research is very much similar to exploratory research in the sense is that, well, we can collect all this data without any hypothesis in the first hand. So we can collect, for example, okay, the genomic, transcriptomic, or proteomics data, okay, from a diseased population versus a healthy population. So once we collected all those data, then we can analyze it using, okay, different computational model or power to actually understand what are the differences, okay, between the diseased population versus the healthy or the normal population. From there, it will then help us to identify what are the underlying biological reason of that disease or pathogenesis and so forth. So this is a new paradigm, basically. Okay, so in fact, a lot of the research nowadays, if you follow the trend, is that actually started with data-driven research now, okay, because it for the first time it gives us the new frontiers to look at things that no other people have looked at before. If you stay put with the hypothesis driven research, basically, as it's stated, is that well, it have to base on certain evidence to start with. But in data-driven research, basically, you might not even have an underlying research hypothesis. All you are going in is basically collect a lot of data and then later on make sense of those data to actually deduce, okay, what is actually happening in the biological system. So if you follow this chart here, okay, this is how, okay, a lot of the big study, okay, for example, the Cancer Genome Atlas, okay, and there are a lot more big projects that are actually undergoing this paradigm. And the important thing is that all the data that is generated, most of the time, it will also allow the scientists to actually look at a particular disease from multi-dimension instead of just testing one hypothesis at a time. So for example, okay, a transcriptomic will, in a single experiment, you can evaluate more than 30 to 40,000 genes in the human genome. So literally what it means is basically in one experiment, it can actually test 40,000 hypotheses at one time. So this is how powerful the data-driven research is. So going beyond the data-driven research, the new trend now is also something what we call the allogenous reasoning, okay, or in general, what it means is a simulation. In a way, is that, okay, if you have identified a certain, okay, phenomenon in the biology, and then you can then launch the data-driven research basically to collect as much as information as possible, and then after that, you use certain type of computational or mathematical modeling, then to fit it in and to understand the cause and effect relationship. When you have established this, or what we call the model, then you can actually every time, okay, input, well, then it works very similar to like a mathematical equation, whereby when you have certain input, then the system will actually generate certain output for you to understand it. So, and this type of simulation basically used a lot in terms of the recent biological science. For example, when we collected a lot of information, we have to rely on the bioinformatics to actually help us to understand it. And what is important about this type of study or this type of research is basically it allows us to develop a type of predictive analytics whereby you can actually predict, okay, the outcome of the patients, or you can predict basically whether certain patients will be respond to certain drugs or certain treatment and so forth. Okay, if you do it well, if this is done correctly, it can be a very, very powerful type of research and very powerful type of analysis as well. So now, if I want to pull all these three together, okay, you have the almost, okay, a century old hypothesis-based deductive or hypothesis driven research, and you have a reasonable, okay, well, with the recent technology to work on data-driven, research and data mining, and you can also now use, a supercomputer or high dimensional computational mathematical model to do a model-based, allogenous, reasoning. So when you combine all these three, basically, ultimately, it will try to generate the overview or the overall picture of what is actually going on. As this is especially important, especially if you want try to understand, biology or diseases, because biology is always complex. There's no single variable that will determine a disease. For example, a disease or a condition are always caused by more than one variables. It could be upstream or it could be downstream, but the idea is basically is that if we can understand the disease as a whole, as holistic as possible, then we will be able to find a cure, or we will be able to manage that disease much better. So in a nutshell, basically, if you look at all the different research model and different approach, at the end of the day, so it always back to this picture here. I still remember when I first entered into Harvard, the first thing that the counselor told us is, if you look at the badge of Harvard, it's written that, Veritas, Veritas. Now, what is Veritas means? Veritas is actually, is a Roman god, actually, is a goddess of truth. At the end of the day, when you look at whether it is hypothesis driven, data driven, simulation, or whatever type of research model that you look at, you have to believe, and I believe that is, if it is a truth, no matter how you look at it, it will be the truth. So basically, at the end of the day, whether whichever model, be it hypothesis driven, or computational or simulation, at the end of the day, well, we are trying to answer the same problem. We are trying to find the same solutions to disease and whatsoever. So, and it make more sense for us to be more open to towards a different research model, and not to just stick to the traditional scientific method. But as the technology comes, it will open up much more paradigm and much more methods for us to look at. So I think that's all for now. Thank you for your attention.